We're at the Bebout Veterinary Medical Center. I'm with Dr. Brandon Bebout, and we've talked about it before. You perform many surgeries, and you did one on Bart. Talk a little bit about Bart.
Yeah, so Bart here, 2-year-old Mastiff boy. He's about $170, 170 pounds, and in our giant breeds, and really any breed with the deep chest, we actually recommend something called a prophylactic gastropexy, which is really just, if you've seen Marley and Me, difficult movie, the reason for that issue with Marley is his stomach flips, and then you're just a race against time about getting surgery done. It's a 50-50 when you walk in the door on whether you're going to survive or not, and so we recommend something, again, the gastropexy, to prevent that rollover. It's essentially tacking that stomach to the body wall so it doesn't have the ability to flip.
Is that something that we see in larger breeds mainly, or can we see it in any breed?
So it usually larger breeds. You're going to see 95 of dogs over 75 pounds for every 100 that you see. It has actually been reported in like dachshunds, so little wiener dogs have deep chests, and then actually there's been reports of guinea pigs. And so they're another creature that we don't typically think about that can also have this disease.
So, what were some of the signs and symptoms that you were looking at?
So with Bart, he actually, he's kind of a unique story just on the surgery itself. He had the surgery performed, and then pretty shortly thereafter, he had gotten into GI signs, vomiting, decreased appetite, lots of diarrhea. Really was just a sick kid, losing about 35, 40 pounds, which, you know, is a lot for anybody. And you know, thankfully he was as big as he is, so he could handle it. And he had seen numerous specialists, actually, a couple different states outside of Nebraska, Kansas, and Colorado. And there's a paper that actually his mama sent me, and it was from UC Davis, which is really a veterinary school out in California, a tertiary referral facility, meaning specialists refer to that facility. And this paper was talking about a malpositioned surgery. And so Bart had come to us with this paper, with this thick medical record, and we had kind of ruled everything else out, and we just said, you know, I think this kid's worth going in there, seeing if there's a malposition here, and went in, and sure enough, there's kind of a kink in his stomach. However, the way it healed against that body wall, and so kind of broke that surgery down, re-performed it, and just today, you know, it's been 5 weeks as of yesterday from the surgery. Mom says he's 90+% better.
Wow.
So really excited for him.
So he's got a fantastic outlook.
He does. He does.
So if somebody sees those signs that you were kind of mentioning, stop by and see a vet.
Absolutely, and the main sign from a GDV, gastric dilatation-volvulus, stomach dilates and flips. Number one thing is we're trying to vomit and we can't. And so that's the sign of a GDV. Obviously, our preference is to get out in front of it and do prophylactic pexy. But if you're somebody that hasn't had that done, we typically do it at the time of spay or neuter. That's something that you're going to want to look for. And then it's not, I'm going to wait and see. It's get us called right away.
Yeah. And like you always say, as soon as you get a new pup, schedule an appointment.
Absolutely. We can talk about all those things in that new pet exam of all the things that you're at risk for.
Well, great information, and I'm glad you're doing good, Bart. Thank you for your time, Doc.
Of course.
Appreciate it. All right, stay with us. We have a lot more next Monday on another edition of Pet Doc.